Okay, well, thank you everyone for joining. I am Annika Isagiri. I'm Communications Director with the Committee to Protect Healthcare. Appreciate you joining us today to hear from Michigan physicians who are calling on former President Trump to share his actual plans for the Affordable Care Act, not just concepts, ahead of his town hall in Flint this evening. We will also have a mobile billboard sharing this message that will be circling Dort Financial Center today from 1 to 9 p.m. Eastern. So if you are in the area, keep an eye out for that. We can also send a picture of that later if you would like to include that in any of your coverage. Before we begin, I'd like to state that these physicians are speaking as individuals and part of the committee, not on behalf of any employers. So we ask that you please refer to them only as they introduce themselves in any of your coverage. And we thank you in advance for being respectful of that. I will now introduce our first speaker, Dr. Harris.
Thank you. Hello, everyone. I am Dr. Asia Harris. I am a family medicine doctor in Flint, Michigan. As physicians, we are asking former President Trump to clearly tell folks when he comes to Flint today what he means when he claims he has, quote, concepts of a plan, unquote, on healthcare. Physicians like us took an oath to care for our patients by using all our skills and knowledge to make sure they are healthy and well. We also have a duty to speak on their behalf when patients face barriers to care, and we're concerned that Donald Trump will put on obstacles that will make our patients sicker, as he did when he was president between 2017 and 2021. That's why physicians in Michigan and across the nation are calling on Donald Trump to spell out his healthcare concepts. We'll even have a mobile billboard going around the Dort Financial Center today to make sure he gets the message. The fact is that Donald Trump has been running for president for nearly a decade, and during that time, he repeatedly promised to repeal the Affordable Care Act. In 2015, shortly after he first started running, Mr. Trump threatened to repeal the ACA, saying it's got to go, and suggesting it be replaced by private health plans. In 2016, Mr. Trump said, if we don't repeal and replace Obamacare, we will destroy American healthcare forever. Mr. Trump tried repeatedly to cripple the ACA, from gutting efforts to help people enroll for health coverage to raising premium costs. Mr. Trump attacks on our healthcare carry serious and harmful consequences for Americans. The uninsured rate increased from 7.9% in 2017 to 8.5% in 2018, or approximately 2 million people. More than 1 million children lost Medicaid coverage between 2017 and 2019. And Mr. Trump's repeal of the individual mandate in the ACA increased health insurance premiums by thousands of dollars, making healthcare unaffordable for middle-income families. In fact, healthcare experts pointed to a chilling effect from Trump-backed policies, including Medicaid work reporting requirements. As president, he opened the door for predatory junk insurance that covers very little even and leaves patients with astronomical medical bills. During his term, Mr. Trump supported Republican efforts in Congress to repeal the ACA multiple times, all of which failed, and the final nail in the coffin of ACA repeal culminated with Republican Senator John McCain's now famous thumbs down. And just earlier this year, Trump said Obamacare is a catastrophe. No one talks about it. With John McCain, we would have had it done. Without John McCain, we would have had it done. Now, Mr. Trump claims he has concepts of a plan. Doctors, our patients, and Americans want to know, Mr. Trump, tell us exactly what your healthcare concepts are. Now, I would like to invite my colleague, Dr. Davidson, to speak.
Thank you, Dr. Harris. Thanks, everyone, for being here. My name is Rob Davidson. I'm an emergency physician in West Michigan, also the executive director of the Committee to Protect Healthcare. Mr. Trump claims he has a better plan to replace the Affordable Care Act. He also called Obamacare lousy healthcare. As physicians, we must be clear in spelling out how the Affordable Care Act, or Obamacare, has directly helped improve our patients' lives. Obamacare's landmark achievement is making sure our healthcare laws contain essential health benefits that are very strong pro-patient protections. Under the ACA, insurance companies can't deny coverage to people with pre-existing conditions. Health plans must cover important health services such as outpatient care, maternity care before and after birth, mental health and substance use treatment, prescription drugs, rehabilitation and therapy, diagnostics and lab tests, preventative and wellness services, and other pro-patient services. Young adults can stay on their parents' health plans until they're 26 years old. The ACA expanded Medicaid so more working families who earned too much for Medicaid but couldn't afford insurance premiums now have health care. By making healthcare more available, more accessible, and more affordable, more people now have a healthcare home. They can see a doctor when they need to, so an injury or an illness can be addressed before they become a healthcare crisis. I've seen patients who were previously uninsured now take charge of their health and live fuller, more meaningful lives. Can't tell you how many people working in a place for about a decade before the ACA who came in with crazy high blood sugars and blood pressures and couldn't go see a doctor, couldn't get insulin, couldn't get their blood pressure meds, who started coming in for more benign things and their blood pressure would be fine, and ask about their diabetes, they now were under control. This was because of the ACA. If you take this away and the protections of the ACA, my patients will lose. My patients with diabetes will have to pay more for their healthcare or even be denied healthcare altogether because of the pre-existing condition of having diabetes. My patients with arthritis and asthma will have a hard time getting healthcare because insurance companies can discriminate against their pre-existing conditions. This will make seeing a doctor to manage chronic conditions much more expensive. The rescue inhalers, insulin, or other medications, which can save lives and prevent complications and prevent costly emergency care if used regularly, will become hundreds of dollars more expensive. People with asthma, people with heart disease, people who are pregnant, these are just a few examples of the people who would face astronomical increases in healthcare costs if the ACA goes away with no replacement. Women will be forced to pay more for healthcare. Around 800,000 Michiganders enrolled in Medicaid expansion coverage will lose healthcare. More than 418,000 Michiganders who get their healthcare through the ACA marketplace in 2024 will be forced to pay much higher insurance premiums. And as many as 2 million seniors on Medicare could pay more for their life-saving medications. Obamacare is a lifeline for so many Michiganders and definitely for my patients in rural Michigan. We need to know how our next president will handle it. Election day is less than 50 days away, Mr. Trump, and Michiganders demand to know what is your plan and not just concepts. Thank you.
Thank you, Dr. Davidson and Dr. Harris. We'll now open it up for questions. If you have a question for either or both of the physicians, there are a few ways you can ask it. You can use the Q&A function. You can chat the question, or if you prefer to verbally ask the question, you can raise your hand and I can unmute you so you can ask that of the doctors. So we'll allow a few moments for people to ask us questions. And we have a question in the Q&A from Sydney. Senator J.D. Vance is visiting Michigan right now, and yesterday he suggested in an interview that the Trump healthcare plan would deregulate the insurance market to split people up into different risk pools, essentially removing the protections for people with pre-existing conditions. How do you react to this suggestion?
I can start with that. I mean, that's the rub. That is exactly what was going on before Obamacare. We had higher risk individuals, typically older folks, people with more medical conditions, would pay more for insurance. They could be discriminated against or even denied insurance. Or if it was just too expensive, they may not be denied, but they just couldn't afford it. And so what he's describing is the healthcare plan of the Republican Party. I think some Republican senators have also said they want to repeal portions of or the entirety of the Inflation Reduction Act, which is allowing Medicare to negotiate drug prices on behalf of seniors and those with disabilities. And so really, this is just reverting back to a time when insurance companies could dictate who they cover, how much they charge, and there was no protection. And so I think this is a critical admission from J.D. Vance. And we're thankful that he's willing to tell us the truth instead of just kind of spouting on about concepts of a plan and how lousy the system is and how they'll make it all better. I think people should be terrified. And I hope enough people learn that this is their plan if they come to power.
And I'll just simply add the idea of not being allowed to have coverage if you have a pre-existing condition. I think it minimizes the fact that we are all human, and people should not be penalized for being human and the health risks that come with that. A lot of people cannot control what medical problems that they end up developing, and they don't know how the next day or the next year is going to be. And it's very detrimental to the growth of our society and just the happiness and longevity of our communities if pre-existing conditions are not covered just because someone is having genetic stuff or environmental exposures or just living their life and they just happen to develop a medical problem. People shouldn't be penalized for that.
Thank you both. Another question chatted to me. I put it in the chat for you guys. Axios reported this morning that some high-ranking Republican leaders want to repeal the Inflation Reduction Act's Medicare drug price negotiations if Trump is elected. What would that mean for your patients?
I guess I can start with that. So when it comes to healthcare access, healthcare costs is has a big impact on how people come to the doctor and how people manage their medical problems. So the idea that drug pricing negotiations are going to be halted and reversed and people are going to have to pay more for their medications is kind of scary. I already have patients, like many of my colleagues, who are not able to afford their medicines on the insurance that they have. Or with the job or income opportunities that they have, and so that's just going to make people's health problems worse. They're going to have to make decisions on covering their rent or covering their groceries, which are much higher than it used to be, or picking up their medicines. And so people have to be creative with their health when they aren't able to afford their medications and their healthcare care overall. And we don't want to see how detrimental that is to people's progress. And medications don't have to be that expensive. And so because they've been unregulated for so long, we're actually doing what we should have done decades ago as far as negotiating these prices, because they've been skyrocketing for a long time and squeezing people out of accessing healthcare that modern medicine has made available for us.
Yeah, thanks, Dr. Harris. I mean, I could just share, I had an elderly person I saw in the emergency department just yesterday who required Eliquis. I think Eliquis is on the list of drug prices that have been negotiated by Medicare to bring those down. And, prescription was sent into the pharmacy and we get a call about 20 minutes later, do you have the coupon? Can we find the code that we can use to give them a free 30-day supply or at least a reduced cost so they can figure out the finances to get it covered in total? And the IRA and the negotiation of drug prices for Medicare directly impacts people that Dr. Harris and I see every day. These are not obscure drugs. These are not obscure patients. These are not made up stories. These are just real people trying not to die from a complication. This person had a blood clot in their leg. If that blood clot breaks off and goes to their lungs, it could kill them instantly. They could die in their sleep. And so as we sit and impress upon them the importance of these drugs, we know how to treat them. If they go to the pharmacy and they just can't afford them, it doesn't matter how much science we know and how much medicine we know and tell our patients, they're just not going to do it. They got to pay rent, they got to pay for food, and thousands of dollars a month for a drug just may not fit into their budget. And so I hope y'all in the press will let people know this is their plan. If they get control, they're going to directly increase those costs and impact people's lives in a negative way.
Thank you. And one more question that's in the chat box. What does it mean for your patients when their access to health coverage isn't secure? How do you treat patients when you know that they might lose or already be without their health insurance?
I can start. The first thing that comes to mind is it's painful. A lot of things that happen in health are preventable. And obviously life is happening, so people aren't able to always get to the doctor or do what they need to do about their health. But the idea of the access being not secure or not available when someone needs it just makes me think of the catastrophic kind of complications and death and different things that can happen because someone's medical problem went unmanaged. It really pains me when something happens like years ago and I have a new patient that comes to me and their blood pressure is crazy uncontrolled, their diabetes is crazy uncontrolled, their cancer is stage 4 and we cannot treat it very well. And these are all things that could have been managed, but they're like, well, I just couldn't go to the doctor. I didn't have the insurance. I didn't have the money. I didn't have the access. And it's just sad to be in a country where we do all these advances for the medical field and our community, our residents aren't able to access it. Like, why are we making all these progress if people can't get a hold of it and take care of themselves? And as far as the lack of insurance, the ACA was an amazing thing. It came along when I was in medical school, and I don't think I understood how, as well as Dr. Davison, as far as how many people couldn't get health insurance without their employer making it available. That just kind of like, I wasn't paying attention as a child. And so the idea that there are a lot less people without health insurance and a lot more people with health insurance now able to access care is an amazing space they were in. And it's very scary to know that that isn't the reality for everyone. And it also could be removed for the people who are accessing it right now. And so it gets hard when people don't have insurance, when they can't pay for things. I like to be creative in my medical care and stay evidence-based and use the resources in my community, but it's very frustrating to know what I want to do and what is recommended. My patient won't be able to access those medications or that treatment or that specialist because of the insurance issue. When it's the right answer and the correct route for them to go to save their life or just manage the medical problem. So it's very frustrating to know what I was trained for and the knowledge I have and the skills I have aren't able to be optimized because of the healthcare access barriers and health insurance barriers.
Yeah, I'm quite a bit older than Dr. Harris, and I can share a story from well over a decade ago of a patient who was in their early 60s, had retired, was taking Social Security, but they didn't have Medicare yet and could not afford the premiums of health insurance. So they were just sort of winging it for a few years and hoping that nothing bad happened. And I saw this person on day 5 of having chest pain and now developing shortness of breath. And, chest pain in someone over 60, a gentleman, is a concerning symptom. This person had a heart attack 5 days earlier. And by the time they saw me, they were in heart failure. When you have a heart attack, you lose pieces of your heart muscle. And we always say minutes equals myocardium. The longer you wait, the more at risk you are. And this person had now developed heart failure, permanent damage to their heart, that had they come in on day 1 could have been prevented. They could have gotten a stent. They could have gotten a drug to break open the blood clot to get blood flow back to their heart. And they didn't come in because they knew how expensive it was. And finally just had to admit on day 5 how short of breath they were. They couldn't barely get, down the stairs in the morning. Said, I had to go in. And you ask them, why didn't you come in sooner? You knew this was a bad symptom. He said, I just couldn't afford it. And if someone like that can afford health insurance with the Affordable Care Act, if they can get expanded Medicaid because they make too much for Medicaid under the old rules, but make just enough now they could, that person can come in on day 1. I unfortunately remember those. And if y'all know how most of us operate as physicians, we carry those stories with us, keeps us up at night thinking about those patients that if not for a system that was completely screwed up, that person would be living a more full life. And thank God the system is better than it was and has a long way to go. And we're still making it better every day. But Vance and Trump and Republicans in the Senate, they want to take us back. And kind of like a lot else we've heard from the campaign of Vice President Harris, we just don't want to go back. We are not going to go back. Thanks.
Thank you. There's a question in the Q&A from Eleanor. Trump is promising to improve the ACA and make it more affordable. What are some improvements that could be made to the ACA? And based on previous policy, do you think those are possible under a Trump presidency?
I mean, I think maybe I'll just real quick, a little bit like what they're doing with the IRA, negotiating drug prices under Medicare. That was Medicare Part D. I was a physician at the time. I think it was in maybe 03 or 04 under Bush when he had a Republican Congress. And it was a great thing to think that Medicare was finally going to cover prescription drugs after 37 years of Medicare. But the fact that they couldn't negotiate prices meant that seniors and the federal government, the Medicare system, was getting ripped off by pharma. And pharma execs making billions of dollars and stock buybacks and paying money to their shareholders and putting it on the backs of Medicare and on the backs of seniors. And the fact that the IRA has fixed part of that and is expanding that list of negotiated drugs, that's huge, right? That's what we've needed. That's what we'll continue to do. Expanding subsidies under the ACA. Trump retracted those subsidies and less people had insurance and could afford insurance during Trump's first term in office. I can't imagine a world in a future Trump presidency where we see improvements like we've seen in the last 4 years. I think we're going to go back.
And I'll just add, I would love to see the ACA have a broader range of providers that patients can see. There's a lot of restrictions on like depending on the plan and where a patient lives on who they can see, and so that makes it difficult sometimes for people to access their primary care people or different specialists. And so I would love for it to be a little more broader and less like, well, you can only see this one person. That one person is, full and not taking any patients, and it just delays their care. And so that's one thing I kind of think about outside of the cost.
Thank you both. We'll allow just another minute in case there are any follow-up questions. But I did want to draw people's attention. I uploaded a picture of the mobile billboard that will be running around Dorrit Financial Center from 1 to 9 p.m. in the chat. I can email that too if anyone would like a copy emailed. Please just chat me or send me an email and I will get that to you after this. Same thing with the recording too. We have been recording this and are happy to share the recording if that would be helpful after. But I'm not seeing any other questions, so we will go ahead and conclude today's call. Thank you so much for everyone joining. I know it's a busy day with a lot going on, so thank you for being here. And thank you so much, Dr. Davidson and Dr. Harris, for your time and your advocacy on behalf of your patients today. We appreciate it.
Thank you.
Thanks, everyone.